Hello, everyone. This is Anna Maria Toronto, Vice President of Marketing at Cincy. Welcome to today's webinar, The Value of Virtual Care and How Concierge Home Care Uses Technology to Optimize Care Throughout the Care Continuum. Today's webinar presentation is being recorded, and we will email you a link to the webinar recording in the coming days. Please note that attendees are muted during today's presentation. If you have questions at any point, please type your question into the chat window on your control panel. At the conclusion of today's webinar presentation, we will review the questions and answer them accordingly or follow up with you individually. Today, we are pleased to be featuring Linda Murphy, CEO of Concierge Home Care. With 4.5 and 5-star ratings across all locations, Concierge Home Care has achieved impressive growth without sacrificing quality of care. Linda credits her agency's tremendous success to a strategic inward focus, retaining excellent clinicians, maintaining operational efficiency, and optimizing technology solutions. As an agency leader and early adopter of new technology, Linda embraces innovation and recognizes its value in helping her agency scale and succeed in home health. Today's webinar presentation will highlight how virtual care technology is making a difference in how Concierge engages patients, optimizes staff productivity, and increases referrals. Let's start with a quick review of many of the patients that your agency serve, the chronic care patient population. Approximately 40% of the U.S. population suffers from chronic conditions, and almost 1/3 have multiple chronic conditions. This population accounts for 75% of the now $3.5 trillion in healthcare spending, according to the CDC. That means roughly 96 cents per dollar in Medicare and 83 cents per dollar in Medicaid. Where do these patients, though, want to receive care? The good news is they want to receive it from you, your agencies, your clinicians, because they want to be home. AARP says that 87% of consumers 65 plus want to age at home. However, you're all facing a challenging position to manage and engage these patients, as well as manage, attract, recruit, retain your staff, and keep the sickest of the sick at home, receiving care versus returning to the hospital or another facility. Unfortunately, the patients typically need more care and attention after being discharged, and sometimes they supplement your visits with their own reliance on emergency medical services and/or the ER to answer questions and provide care in non-emergency situations. The budget and resourcing implications are significant. Most of your staff's time is probably spent behind the wheel instead of in front of the patients and caring and seeing for your patients. And changes under PDGM may also impact your agency's productivity and profitability in 2020. Increased communication with patients has been shown to decrease rehospitalizations, reduce association penalties, enhance patient satisfaction, and most importantly, optimize overall care. A virtual care communication platform can automate and optimize your organization's existing workflows while delivering cost-effective, patient-centric care. How does this work? Video-based virtual visits allow your clinicians to review patients' condition, address barriers and issues to lifestyle changes, and also reconcile medications with prescribers and physicians and pharmacists in real time. Your traditional in-home visits can be replaced and/or augmented with these virtual visits, which increases the productivity of your home health staff and enables staff to see more patients more frequently. With the platform, your administrator can schedule a series of patient-directed communications. Emails, secure messages, texts, all HIPAA compliant, can be used in between virtual visits to teach patients behavioral modifications, encourage exercise as well as physical rehabilitation, reinforce the dietary adjustments and nutritional needs, and educate patients about their medications and improve compliance. By maintaining frequent contact with these patients, your home health clinicians can adjust patient care as needed and quickly intervene if the patient's situation needs immediate intervention, thus preventing the revolving door back to the ER and the rehospitalizations. Better management and engagement of these patients will help agencies minimize the number and length of hospital stays, leading to improvements in quality of life and cost of care. Historically, post-acute providers have been the least likely to be engaged in virtual care. However, the situation is changing. Especially under PDGM in 2020, the higher reimbursement rates for institutional versus community referrals means that agencies are actively reexamining their case mix and referral streams. Evidence showing how an agency minimizes avoidable, costly readmissions can help fortify their value propositions with hospitals and skilled nursing facilities. Recruiting, retaining staff is key. Staff shortages and churn can cause a breakdown in the continuum of care, increase the risk of readmissions, weaken overall outcomes, and ultimately harm an agency's reputation. Increasing staff productivity while reducing travel time, plus a corresponding decrease in related expenses and liabilities, boosts your agency's bottom line. By implementing a virtual care platform, agencies can better prepare for the estimated impact of PDGM reimbursement changes and better leverage existing staffing resources to address the growing patient population needing home health care. It is on trend, right? And probably you in your own lives have used virtual care and telehealth solutions to receive care, especially for cough, cold, and sneeze situations. Patient portals seem to be a thing of the past. 2016 software advice poll indicated that patients are frustrated with the design and the user experience of these portal tools. 41% of the participants of this poll indicated that they gave up on using portals after being overwhelmed with the inability to navigate options. And 37% of patients were frustrated by a lack of staff response via this technology. So instead of relying on the static portal, healthcare organizations, and specifically post-acute care organizations, are embracing the dynamic nature of video, email, text, and secure messaging to reach patients via the devices that the patients already use, their laptops, their tablets, their smartphones. And as a result, patients are on top of their care, actively participating and assuming their role of self-care within the treatment plan. Now, you may be thinking about your own patient population and saying, well, it's unfortunately a very older, it's a very chronic care population. They might not necessarily have the devices on hand. Well, what's interesting is that the device usage, the device ownership continues to grow within each segment of the population. According to recent Pew Research Center survey of U.S. adults, 77% of all Americans owned smartphones in 2018 versus just 35% in 2011. And that's 67% of baby boomers and 30% of the silent generation. And the usage and the ownership continues to grow. More than half of boomers own a tablet computer, and many currently use social media. Even though the silent generation may lag behind other age groups in device ownership, it is really important to note that their family caregivers, whether they live at home with them or they're nearby and coming to visit on a frequent basis, typically have the devices on hand and also can assume an active role in the care of the patients as well as an active role in communicating with your home health staff via virtual care platforms. Patient engagement apps are helping patients better understand their health situation and be better prepared for their role as they transition from inpatient to outpatient. I really like this quote from Stanford Medicine ex-patient advocate and Hugo Campos, and how he indicates that no patient wants to engage with healthcare. They want to engage with life. Here are some examples of the real challenges which really can be solved by virtual care. Patient expectations in requesting receiving home health care is evolving, and home care is really the most unique practice setting because the nurse or other team members from your staff must fit into and function effectively in the patient's space. And it's their most beloved place oftentimes, rather than the patient fitting into a hospital or other setting or point of care. Your visiting clinicians must adapt, be flexible, understand the dynamic that's continually changing within the traditional healthcare settings as well as someone's home, and keep in mind that the home health team members are essentially guests in patients' and family lives and in their homes too. So, to best serve, support patients, home health clinicians are advised to see these patients as partners in care versus consumers of care, and that these partners in care, the patients themselves, have great influence on how and when the care is delivered. Home health care is patient centric by nature and must reflect and respect the patient's lifestyles, values, belief systems, home environment, and family and friend relationships. For many of your patients, you are caring for them post discharge from a care facility. And part of your agency's objective is to maximize the patient's return to health or a stabilization of their condition while minimizing the risk of readmission. There are many reasons why patients are readmitted. A couple things, such as upon leaving the hospital, your patients are unfortunately commonly deprived of sleep, they have pain and discomfort, they haven't received enough nourishment, and they confront an array of mentally challenging situations. They've also received medications that potentially can alter their cognition and physical functions, and they're typically less active simply due to bed rest or inactivity. There's also some support factors too, which come into play. There may be a lack of stable living situation and or support at home, and they're fearful of what happens next and who cares for them next and what's the best way they're going to continue to receive outpatient care. They may have low English skills and or health literacy and are afraid to ask questions or unable to ask the questions in a way that the answers will truly resonate with how they approach health and what they know about their situation going forward. And just because an individual was admitted for one specific situation, they may have multiple things going on. I pointed out that a significant portion of our population unfortunately suffers from multiple chronic conditions, but there could be also other factors at play: multiple medications, psychological issues, alcohol drug dependency, and their overall health may be compromised even before they were admitted. They may be frail or have a disability. Lastly, their healthcare history must be considered. Why were they recently readmitted? Do they have frequent emergency department visits? And for what? Are they unfortunately what the industry calls the frequent flyers and are in and out of the revolving door of the ER and other institutions? As well as, are they being discharged during a weekend or even on a holiday where staff and family members might not necessarily be available nor committed to thinking through the right things at the right time? All of these factors are obviously things that your team is considering as they deploy the at-home treatment plan. And readmissions, it is a hot topic. We understand what is happening from the hospital side of things with the readmissions reduction program and from the health plan side of things. But what we're all caring about is really the patient side of it. What is important to help these populations that have comorbidities and require more health and socioeconomic assistance than other members, and how do we keep them at home? Your referral source could be a hospital or a SNF, could be the physician as well. They don't necessarily set up the patient for success before he or she is discharged. There may be a focus on the discharge versus the actual transition of care. There may be no ownership of the transition, and it's kind of left to the patient or family members who might not necessarily be present during all clinician interactions. The burden of coordination, transportation, even home, is sometimes placed on the patient and could be overwhelming as well. There could be an absence of the common medical record, absence of coordinated medication reconciliation, and no plan for when the patient's conditions is going to be actively assessed by both the home health agency as well as the referral source, and keeping that in mind as people continue the continuum of care. The unique situation of the patient also plays a role during and after the transition of care. Patient is provided with comprehensive verbal instructions and may quickly forget the instructions soon after discharge. Written instructions may be provided to the patient, but in absence of a family member or friend, the information is not necessarily conveyed, saved, brought home, and it may be forgotten or misplaced after discharge. And a lot of times the patient returns home, becomes a bit complacent once they return home. And you probably are aware of this when all of a sudden the patient or a family member says, "Oh, we're not sure we need your services anymore." And it's very hard to convince them that it's important that they continue on this journey together in partnership of their treatment plan with a home health agency. Because CMS is reducing Medicare payments to hospitals with excessive readmissions within 30 days of discharge for certain conditions, the hospitals, the referral institutions, are focusing on how home health agencies can help reduce readmissions. When evaluating agencies for post-acute care referrals, hospitals are prioritizing agencies who've been able to demonstrate a reduction in readmissions as well as an improvement in clinical outcomes. Home health providers are able to help hospitals reduce these readmission rates. You play truly a very active and critical role, especially during the critical 30 days following discharge. And virtual care communication platforms are increasingly being utilized to help home health agencies such as yours improve patient outcomes and reduce readmission rates. So, in a nutshell, before I turn it over to Linda, I'll just quickly summarize how virtual care can help home health agencies improve outcomes and reduce unnecessary and costly readmissions. First of all, with a virtual care platform, your home health providers can actually be introduced to the patient before the patient is even discharged from a hospital, skilled nursing facility, etc., and help set expectations on the follow-up appointments. After the discharge, the provider can use video and messaging to monitor progress and motivate the patient to adhere to the medication plan and lifestyle changes on a regular basis. According to the CDC, adverse drug events cause approximately 1.3 million emergency department visits each year, and about 350,000 patients each year need to be hospitalized for further treatment after emergency visits for adverse drug events. With a virtual care platform, your providers, your clinicians, your staff members can include additional providers who can answer patient concerns which are outside the realm or scope of their responsibilities without requiring the patient or the external specialist to travel to a different location and truly reconcile the medication, address any concerns, and make sure that the patient is again on the right track with his or her compliance going forward. Discussing important care instructions to patients is vital to the prevention of readmissions. And a home health provider can use a virtual care communication platform to introduce an interpreter into the video call to deepen patient understanding. The messaging as well can also be translated into the patient's primary or preferred language, so it truly resonates with the patient. And in addition to pharmacists, providers, interpreters, the patient's family. In some ways, The caregivers with a capital C in their lives, whether they live close by or far away, can be included in the video-based virtual visits. And involving family members in the care, support, and communications really helps the patient transition and also strengthens their understanding and commitment to the care plan, as well as saves valuable time and money on behalf of the family members who don't necessarily have the flexibility to be at their loved one's side all the time. And last, what really gets back to the heart of this is it really is about the data. With virtual care platforms, it's recognizing that you're able to gauge the level of interactions, the activity, the interest that your patients have in their care, and their degree of engagement. And this helps you truly understand who is engaged in their care, and if not, arrange for an immediate intervention in the home, preempting unnecessary and costly ER visits, transfers, and readmissions.
So thank you, Anna Marie, and thank you to our audience that joined us today. I really appreciate you spending a little bit of your midday here on a Thursday. So Concierge Home Care is actually still in their infancy. We're an agency. We're getting ready to celebrate our 4th year of accepting our first patient on June 12th next month. And we are located in North Central Florida. So we cover 23 counties throughout the North Central Florida area. We currently have 5 offices. We operate with 3 licenses throughout that territory. And I'm very, very proud to say that we're 4.5 and 5-star ratings in all of our offices and have been able to maintain that pretty much since we started the agencies. Our first couple of agencies that we did acquire were not performing very well, but within a quarter, we were able to get them up to 4.5 to 5 stars by putting them on really the entire platform that we have here at Concierge Home Care. Little history on myself. I was graduated from the University of Florida and was an ER nurse at Shands at UF in Gainesville, Florida for almost 15 years. Really kind of fell into home care unexpectedly after a bout of cancer at a young age, and had stage 3 breast cancer, and was not sure I wanted to go back to working weekend nights or 7 on, 7 off. So, but did have the opportunity during my college nursing program to spend an entire semester doing home health. And there was no question for me from the first day I saw my first patient that there is nowhere else in the continuum that you can make the difference like you can in home health. And again, that was rekindled as I started as a PRN nurse out in the field back in 2002. For many years, I worked for a large publicly traded company over that period of time, and was extremely fortunate to several years ago go out on my own with a few other partners, and that's how we got Concierge Home Care started. Next slide there. What makes us different, and why do I think we really have been able to be very successful? We're currently touching approximately 1,600 patients on a day-to-day basis. We also have a solutions division that we do physician support services. So in that division, we touch quite a few patients as well through chronic care management, and we also have an ACO. But honestly, I think it's a culture that we've tried to really ferment since day one. Servant leadership is really our mission, and we try to live that on a day-to-day basis. A couple of pictures here to show our team. Our HR department isn't called an HR department, it's our heart department, and they work really well with wellness programs and other ways to give back. One of the things that I used to always believe, and I've always said, you do the right thing by the patient and everything works out. But as I've moved forward with our own company, honestly, we take the mission of do what's right by your team members, and they'll take good care of our patients. So that's truly what we try to exhibit on a day-to-day basis. So we do have a lot of programs. I will say I'm an early innovator, an adapter of any kind of technology. That absolutely has its pros and cons, but I can say I think I've hit it out of the park with being an early adapter with Cindy. So one of the pieces where I brought Cindy in was really to partner in my whole campaign for preventing rehospitalizations. So we do have a hospital-to-home transition program that we've had for many, many years, exists with some liaisons. We try to meet with all of our patients, much like I'm sure each and every one of you do. We do have an amazing predictive analytic program embedded into our EMR system that we use to help us better identify our highest risk patients. We call that risk point. And I've had a telemonitoring program since the day that we started our company. I first I've used two different platforms. The second of those platforms actually had a virtual visit ability. And so we started to embed, I house our telehealth program. I have my own RNs and LPNs that run that program 24/7 days a week. And when we added the virtual visit to that platform, it was amazing the difference that it made. And I mean, everybody has probably used some type of FaceTime or Skype, and you have to say the connection is completely different than actually just speaking on the telephone. So there's no question in my mind that virtual visits made a difference on our high-risk patients. But for me, it was honestly an affordability piece. I couldn't afford, with the small margins and the decreasing margins that we have in home health, on how I was going to honestly put iPads in every patient's home in order to do virtual visits. And that's really why Cindy worked so well for us. Now, I was very fortunate. I had no idea as we started to look at a virtual visit platform that was more affordable so that I could touch more of our patients coming out of the hospital. But they're actually more than just a virtual visit. It's an entire communication platform. So I feel like I have gotten so much more than I initially anticipated. Next one. So just to give you an idea, we started from day one. I was very fortunate to have relationships, and a lot of our team members to have relationships with a lot of the C-suites. So just to give you an idea, we are a preferred partner in almost every one of our local 26 hospitals throughout our region. It's usually one of the top 3 preferred providers. And if you're not in a state where you're finding the hospitals are really moving towards picking a network of preferred providers, I could tell you they are definitely doing that here in Florida. And the competition is very, very strong. And honestly, all my competitors and coworkers in the home health arena, with not being a CON state, I feel like we all stay on top of our game, and in the end, our patients gain from all of the competition and the care that we strive to provide to our patients to be top notch. So we have started a sepsis pilot. We've done CHF pilots throughout our territories. We've had some very, very successful programs with that. Some of those are not involving what you consider as just your typical home health. We go outside of the box a little bit and being able to provide options to our hospitals. We have stroke pilot getting ready to roll out with Ocala Regional Medical Center in West Marion here shortly. We have we're a bundled partner with Florida Hospital. We have ACO relationships throughout the region. We also have private duty, and as I mentioned earlier, we do have a third division of our business called Concierge Solutions, where we help to physician partnerships and help them with their MACRA, with chronic care management, and some of the other services that help physicians kind of navigate through what they're going through and the changes that they have in the healthcare arena. Next one. So one of the things everyone on here is probably thinking virtual visit, but I'd like to talk just for a few minutes about even the platform that we have through a texting option. So I can tell you with our courtesy concierge calls that we do after patients are discharged to check on our patients. It's amazing how many times you'll frequently find where a patient has had an exacerbation of their disease process and they are now on service again with a different agency. And they frequently, even when they go into the hospital, when the case managers ask a patient, what's your choice, what's your agency of choice, if they've had home health in the past, frequently they're going to remember Nurse Susie or PT Ron that cared for them. And many times they forget the name of the company. So I know brand, and especially for us being a new company, only a few years in the making, branding was really important to me. So I had no idea when I was looking for a platform that would help me with my outcomes that I would be able to actually help from a marketing strategy and really getting our name out there. So we have the ability to do pre-programmed messages, appointment reminders for our patients. And I had struggled for many, many years. I can tell you my dentist probably sends me 10 reminders coming up to my appointment, just hoping that I'm going to make it there. So I had been asking for a long time of our EMR system and other options out there to help our clinicians remind their patients about their appointments coming up and getting those. How can I make those, have my clinicians have a more streamlined process of letting their patients know what time they're coming in the following day. So this was a wonderful benefit of Cindy for us. And honestly, another way for us to keep in contact with our patients after their discharge, to be able to give them flu season reminders, post-op reminders from doctor's appointments, or just educational pieces in regards to the calendar. We send out calendar reminders through the year, for February about Heart Month, and June being Men's Health Month, make sure that you are going in and getting your prostate checked, just little educational pieces that keep the branding of our company in place. Next. The other thing I would like to talk about the texting too, just going back to there, is we've also built in disease protocols. So any of our patients, as they're being admitted from the hospital and we see what diagnoses they've been referred to, we have the ability to do one or multiple diagnoses or comorbidities and send out automatic education that is programmed out over the next 60 days that we're seeing our patients. Again, reminding them of our agency. It links to educational videos to help our patients, reinforce the education that our nurses are doing on a day-to-day basis and the protocols that we're following. Now, I will tell you one of the neat benefits, or one of the wonderful benefits, is we did have a patient on a Saturday call our on-call service, and it was a son that was actually out of state that was visiting his dad, and we had a blood pressure machine in there, and it was taking the blood pressure, and the son, and his minimal exposure to his dad's normal vital signs, was was alerted and felt like, oh my goodness, something's going on with my dad. Let me call the on-call service and see if I can get a nurse out here, or do I need to take my dad to the emergency room? Now, mind you, his dad's blood pressure was only 140 over 82, but this was a young man that his normal blood pressure ran about 110 over 60, so he thought his dad's blood pressure was very abnormal. So we were actually able to do a virtual visit right with the patient and just be able to pull up his dad's history, show that to his son, go through all of the care that his dad was receiving and what was going on. And due to that face-to-face interaction with our nurse, it relieved any of his concern. Prior to this, I would have ended up having that call, having my on-call person take that call, and honestly send a nurse out to make sure that there was nothing abnormal, and to help relieve this son's concerns, which probably most of you realize that it's actually loved ones that send their patients back to the emergency rather than the patient themselves 9 out of 10 times. So again, it saved me the cost of diverting my nurse that was already seeing patients over the weekend to going out and seeing this patient. The son was extremely happy and had great feedback. And this actually helps with your quality measures for patient satisfaction as well. Another use case, which I had never considered when I was first looking at launching Cindy in our agency, was we do some post-op urology care for a physician. And he actually pulled us in and he was looking at options for how we could service his patients after hours. He was adamant about not allowing any of his patients to go back to the emergency room. And he was finding that after hours, sometimes his nurse practitioners or ARPs or just patients themselves were going back to the hospital and they were being admitted for reasons that he felt could certainly be avoided in the territory where we're servicing. So we actually worked with him to do a virtual visit platform that we engage. They actually pay us private pay aside of our home care business to do an on-call service for them after hours. And honestly, we don't get that many phone calls, but it's been a very beneficial relationship with that physician. We do that at fair market value. But this, again, has stopped. He has had 0 rehospitalizations of his patients in the last year since we started this program. And we're actually able to virtually bring that his nurse practitioner or his PA in on a call in the patient's home if we even need to go out and see that patient. Again, saving us from sending that patient to the emergency room, and great patient satisfaction. They pass some of this cost on to the patients, and these patients are very happy to do that as long as they don't have to go back to the hospital. Next. So I am sure, much like most of you on this call, we have a task force in place getting ready for PDGM and really trying to identify how PDGM may change our agency and what that looks like moving forward. So I've been using remote patient monitoring really from that platform and engaging that with our nursing and working towards how do I reduce overall nursing visits but add quality and effective outcomes for our patients by adding additional virtual visits. So recently I was just listening to a webinar yesterday as we speak about utilizing physical therapists and patient remote monitoring in the future with PDGM. So I just thought this was an interesting statement from CMS clarifying in their final rule, as therapy goals must be established by qualified therapists in conjunction with the physician. You know, we believe therapists involved in care planning as well as other skilled professionals acting within their scope of practice may utilize remote patient monitoring to augment this process. And if you speak with anyone from a remote patient monitoring, there's a lot of work going on right now trying to figure out, you know, how to reimburse outpatient and home health, you know, for this remote monitoring. But I do think that if you're not thinking about remote patient monitoring with your physical therapist down the road, that you're not thinking about what the future looks like with the new payment model that is going to be affecting each and every one of us. So just a couple more. This is actually from our first little week, our management team, what we look like on a regular day-to-day basis. But extremely proud and excited about what Cindy's offering us as an opportunity to really navigate through this changing healthcare arena that we're in, and I know is definitely an answer to the future for us in providing quality care and in an industry where our margin is getting smaller and smaller. So I appreciate that. So, and I'm open to any questions as time moves on.
Thank you, Linda, for sharing your insights as well as best practices for all of us to consider going forward. If you do have questions, feel free to type them in the chat window and we'll bring them up at the end of today's webinar presentation and address them. I know there is a question that is usually raised in these webinars, which is, will we get access to a recording of this webinar? And we will make that available to everyone as soon as the recording link is available. So stay tuned and look in your inbox for that email. In thinking about virtual care, as Linda pointed out, home health agencies see the value of implementing patient program-focused engagement and communication paths. And one way to do it is to be thinking about the top diagnosis codes for hospital readmission and or patients with specific chronic conditions. So it could be for CHF, COPD, diabetes, could also be looking at the physical therapy side of it, and using your staff to think through what is their current workflow, what is their current outreach, their points of contact, and how can they also be automized and optimized using a virtual care platform. So the platform can enable your administrators to engage these patients to take an appropriate action. Could be taking their medication, could be participating in a virtual visit, refilling a prescription, making diet and lifestyle modifications, etc. And your administrator can customize the cadence of communication touchpoints by condition, office locations, and provider group. And you can really look at who's at high risk of being readmitted within 30 days, who has more of a moderate risk for 60 days, and who's at a lower risk in terms of maybe being readmitted just once within 90 days. And scheduling the type of outreaches accordingly to that. As Linda pointed out, what's helpful for Concierge is that right away the patients are welcome to, in a way, Concierge's family, welcome to their care, setting up the expectation that they will continue to be hearing from Concierge both in person as well as via their preferred modality. Could be video, email, secure message, or text. When we look at engaging patients on their condition, of course, you can segment, you can stratify your patient population accordingly. You may even have specialists that really focus on specific conditions and making sure that their workflows are complemented by what can be done from a virtual standpoint. And the time and the money savings as well as the liabilities really will pay off for your patients as well as your bottom line. So the benefits are for your patients, but the benefits are for yourselves and for your staff members. For the patient, they receive more timely and easier access to high quality specialty care. They now know who to reach out to when they have a question about general health care or they have an immediate urgent need regarding a concern about their condition. Earlier decisions and immediate interventions can take place when needed. There's no need to wait for somebody to drive to the individual's home. So as Linda pointed out, that saves the agency that time, money, stress of dispatching someone, especially if it's over the weekend, on a holiday, when, a lot of these things happen. They don't happen during the 9 to 5, right? Times of life. There's also greater comfort for the patient. They're able to remain in their home with family support, as well as the support from their nursing team, which really helps, especially some patients, feel less isolated, less lonely. And that's important when you think about the SDOH. And patient and family caregiver experience and satisfaction improves. And that means it improves your ratings as well, because the family, the patients are in more frequent touch with their home health clinicians and more engaged in their care. Now, for your agencies, what you'll be able to see is that there's reduced unnecessary transfers to other points of care. There's better scores, better ratings, reduced travel expenses and associated liabilities involved with staff no longer needing to drive to see every patient for each and every interaction. And when it comes to your staff, there's better attraction and retainment of your staff along with increased staff productivity. We recognize that staffing shortages is really a top concern of many agency owners and executives. And employee churn leads to canceled, rescheduled appointments, and it can undermine an agency's ability to take on new patients, which leads to a lot of unfortunate results: a breakdown in the continuum of care, weaker overall outcomes, and an increased risk of readmissions. And ultimately, this can adversely impact your agency's reputation amongst community and institutional referral sources. With a virtual care platform, your organization can better utilize your current staff while being able to provide better, meaning more timely and higher quality care to your patients, as now your staff isn't always going to be behind the wheel. Now they can be more often in front of the patients virtually. And the reduction in that weekly travel time, along with the corresponding decrease in the related expenses and liabilities, positively impacts your bottom line and your ability to optimize the use of their current staff. Your staff's going to appreciate this flexibility, right? They're going to be thinking, wow, now they can provide care from your locations as well as their home and throughout the day, night, and geography that they serve. What does this do? It really helps achieve greater staff satisfaction, retention, and engagement, helping your home health organization achieve the quadruple aim in healthcare. So, Cinzy, as Linda pointed out, they use Cinzy to help in this manner to augment and also innovate their delivery of care. Cinzy has developed a state-of-the-art integrated communication platform. It goes beyond traditional telehealth applications to help organizations such as yours effectively engage patients, as well as providers, specialists, pharmacists, interpreters, and family members across the continuum of care. Multiple touch points enables your patients to really remain engaged in their care. And it drives this effective engagement because agencies have the flexibility. It's all about understanding how your patients want to receive their messages. Is it email? Is it secure message? Is it text? And making sure that you're doing the right thing for your patients at the right time in order to both monitor and motivate them in their role in self-care. A couple things that we hear from Linda's team in terms of having the staff, how do you say, glom onto the solution that Cinzy provides. First of all, there's the terminology. For people to be thinking of it as it's more than just a solution. It's really another tool that they're using to engage and communicate with their patients. It's also truly intuitive. So from the get-go, the training sessions are very quick, and your staff will ultimately realize it works like any other app that they normally use in their own personal lives. And it's designed to do that for a reason. You have more important things to do, your staff does as well, than to sit and be trained for hours on end on every single new technology that comes out. So we want to make sure that it's easy to use, it's quick to use, and it's something that really brings people back in time and time again, and they talk about it amongst themselves and encourage additional usage throughout the staff. Role-playing exercises really helps alleviate your patient's concerns, your staff's concerns. It also lets you know that you can be thinking of other use cases. A lot of times, like when we sit down with Linda, with her team, we'll say, okay, what do you have coming up? What are the additional, meetings that you have when you're thinking about referral sources or just even the schedule of your staff visits in the coming week? And we talk about how the virtual care can really be used in that regard to kind of supplement or replace some of those visits that people normally would initially, of course, naturally think that it should just be an in-person at-home visit. And last, to recognize the early wins. The early wins could be something as much as you've got a high percentage of your users, you're enrolling patients immediately, and also it could be just the fact that you're able to see that this is something that helps support your value proposition in terms of being an innovative as well as very accountable partner in the care continuum within the broader healthcare ecosystem. How do you measure success? Well, first there's time to consult, fulfillment, so benchmarking the time duration between consult request and provider response versus less dynamic non-video platforms such as the phone and such as in-person consults. There's also thinking about the diagnosis which are made and the decisions as well, whether it's by your teams, outside specialists, etc., how easy it is to do it now with a robust video platform such as Cinzy's. Patient adherence, patient engagement is key, and making sure that you look at the data to see how it truly impacts health behavior and positions your organization for downstream cost savings. And readmission rates. A lot of times this is, what, your referral partners are going to be thinking about, and being able to prove to them that it's not just about people like the solution, they're using solution, but it's all about the outcomes with the capital O for everyone to look at. Your staff utilization, your satisfaction rates, and then, of course, the patients themselves. All of this positively impacts the brand equity. All of it positively impacts the reputation that you have with other families that you will be serving, your greater community, your referral sources, as well as your staff. Couple takeaways. So, Cinzy, what it allows is enhanced connectivity, and it facilitates timelier, more collaborative, more convenient, and cost-effective care. By deploying a virtual care engagement and communication program, your staff is able to improve patient engagement and lower the risk of readmissions, especially with those patients of yours which are at risk for readmissions within the critical 30-day window. It should be designed with your patient's preference for modality in mind. As I pointed out, Cinzy works across all common devices that your patients, that your caregivers, that your staff already has. So it's the smartphones, it's the tablets, it's the laptops, it's the desktop computers, and it's really device agnostic, but also it's important to note that it works across all levels of cellular and Wi-Fi connectivity. And a lot of you probably serve patients which are more rural, more remote, and this is when it's even more important that you have that compassionate, convenient care. And you're not able to necessarily drive 2 hours to see them every day, but regardless of the Wi-Fi connectivity, you can still use cellular to communicate and do robust, stable video calls with those patients. The data tells the story, and the data, the reports, the dashboards tell the story to your staff about who is actively engaged in their care. So, which patients are responding to the emails, the text messages, and which ones are not. And if they're not, they're most likely the ones which unfortunately are at risk for noncompliance and or readmission or worse. And that really sends the flag, right, for your team to do something immediately in terms of what's the right intervention that needs to happen to make sure that the people are brought back onto the treatment plan at hand, or other measures are taken to make sure that they're cared for appropriately at that stage. So virtual care helps physicians. It helps your home health teams conveniently remain in touch with each other and their patients, leading to better outcomes overall. Thank you, Linda, for sharing your experiences and insights regarding the use of technology, and specifically the use of Cinzy's virtual care platform to increase referral sources, strengthen patient engagement, and improve overall outcomes. And thank you, everyone, for listening to today's webinar, which was hosted by Cinzy. As Linda mentioned today, it will be crucial for home health organizations to use virtual care communication platforms such as Cinzy's to help deliver cost-contained, compassionate, critical care in a more timely manner. Especially with PDGM 2020 around the corner, everyone is really looking at their bottom line and making sure that they're focused on growth and doing the right thing by their referral sources, their staff, and most importantly, the patients that they serve. This concludes our presentation today. There have been a couple questions which have come up that we will respond to those participants individually, so I do appreciate your time and thoughts for putting pen to paper, so to speak, in our chat window. And we will be sharing a recording of today's webinar presentation in the coming days. Thank you again, everyone, for your time and your interest.